Well, on Tuesday, Governor General Mary Simon will deliver her first speech from the throne, outlining the government's priorities. We got a good idea of what to expect from the government. Got that from the House Leader today, Mark Holland, and he is with me now. Mr. Holland, good to see you. Congratulations on your appointment to Cabinet. Let's start there, and for taking time to speak with me tonight. Appreciate it.
Thank you, Peter.
Look, let's get to the government priorities in just a moment because you outlined those today. Let me start with the vaccination policy for Parliament Hill and your concerns about exemptions for some Conservative MPs and casting doubt on those exemptions today. What's your concern?
Well, my concern is the Chief Medical Officer of Health for Ontario has said that there should be about 1 in 100,000 you should see exemptions. The problem is with the Conservatives having 119, it appears there's more than one. It seems there's a number of different folks who have sent in a letter. That doesn't comport with that math. So clearly something is amiss, and the Conservatives won't tell us how many folks haven't been vaccinated. And why is this a concern? Well, I mean, look, last week the Conservatives had a caucus, a member tested positive, and now here we are in the House, unvaccinated members with exposure to somebody with COVID being in the House. That's a great concern.
How do you know how many letters have been sent in?
Well, we don't, because the Conservatives won't tell us how many folks haven't been vaccinated. And we can only extrapolate from what we've heard in a variety of different places that the number is more than one, that there's a couple, there are several. I don't know if that's 3, 4, 5, 6, 7. I have no idea. The Conservatives refuse to say.
Right, but are you suggesting, though, that if they've obtained exemptions, that they might have obtained them fraudulently? What are you saying?
No, I'm saying that the Chief Medical Officer of Health, not only in Ontario, but many across the country have said that some of the letters that have been given out are not actually comporting with legitimate reasons why you should be getting an exemption. And so the fact is,
well, that would suggest that the doctors were giving letters to members of Parliament that would then be fraudulent.
Well, I think the question is, particularly at the early onset of this, is that there may be some doctors with misinformation. I don't know. There may be a doctor who thinks that it's appropriate when it isn't. All I know is the math doesn't add up, right? I mean, 1 in 100,000. If you're talking about 119 people, you shouldn't be having 3, 4, 5, 6 different cases of people with those kinds of odds. You'd be winning the lottery 7 or 8 times over on the same day with those kinds of odds.
What process?
So it doesn't.
Sorry, what process do you want to see then to verify that any exemptions that might have been filed with House of Commons officers are valid and authentic?
Well, I think the process is very simple. I think there is a clear list of what constitutes a medically acceptable exemption, and we need an attestation from a doctor that whatever their condition is meets that criteria. If it meets that criteria, then we certainly would be satisfied. Right now, we don't have that, and unfortunately, the House doesn't have the means to otherwise check it.
Conservatives say that, look, we're going to hear from Candice Bergen, Deputy Leader, in a moment. They say exemptions are private health matters, and they're the business of the MPs who obtain and file those exemptions with the House. They don't need to be shared as long as they meet the criteria for an exemption. So what do you say to that?
Peter, my health, the health of every person who works here on the parliamentary precinct, whether or not they be a staff person, whether or not they be a journalist, whether or not they be an elected official. The health of every single one of those people has to be put first.
Conservatives in the bloc oppose a continuation of hybrid sittings, or an extension, a return to hybrid sittings. Everybody was in the House today. Liberals and New Democrats favor more hybrid sittings. You can't get a deal on that. So let me ask you, will you be moving a motion, perhaps as early as this week, to implement hybrid sittings and put that to a vote?
Yes, absolutely. We're going to be introducing a measure to extend hybrid provisions. Look, I don't want to be back renegotiating this in February or March. We're still in the middle of the pandemic. We need to have the flexibility. And this is not like a local restaurant. This is people flying in from every corner of the country commingling in a space for very long hours, and then flying back at the end of a week to every corner of the country in the middle of a pandemic. This is a very different kind of circumstance, and we need to be responsible. And I personally am still hopeful, particularly given the fact that we had a COVID case in the Conservative caucus that's just happened, that we can find a way to do this, because, by the way, they're disenfranchising their own members. I mean, if a member becomes symptomatic, if a member gets COVID-19, they're not going to be able to participate in the House proceedings. Well, there's a simple solution to that: continuing the hybrid provisions.
What are the key bills you believe you can get passed in the next 4 weeks before Christmas?
Well, I think that we have an absolute need to pass the pandemic benefits package. There are still a lot of folks who are being adversely affected by COVID-19 and the lockdowns who aren't able to continue normal employment. We're seeing great things in terms of both job creation. I mean, that right now Canada is ahead of where it was before the pandemic on jobs. We're among leaders in the G7 in terms of economic growth, but there's still people who are being hit hard and left behind. So we have to help those folks. So we need to get that done. We need to be able to deal with 10-day paid sick leave. We need to be able to deal with a ban on conversion therapy. And we also need to make sure that frontline workers are not menaced in their workplace, as we've seen from some of these protesters who are making their workplaces unsafe. They're there for us. We got to be there for them.
So you'll need a partner in a minority parliament from one of the opposition parties at every step to pass these bills. How far along are you in the conversation with the New Democrats to have them, at least on these 4 bills, provide speedy passage before Christmas?
Well, Peter, we've had some really wonderful conversations with the other parties. I feel very buoyed by the spirit of cooperation that has really been part of those conversations.
From all of them?
And so from all of them.
Okay.
Yeah, absolutely. You know, I have to say that talking with Gerard Deltel of the Conservatives, he's a preeminently reasonable individual who I think I can work with. Peter Julian and I have had a lot of conversations. Alain Terrien and I have had a lot of conversations. So there's, I think, a lot of opportunity to work together here. And I'm trying to get as much support as I can for our legislative agenda, because I think there are so many areas where, where our interests and the constituencies that we represent overlap. And I think people expect to see us working together. That's what I'm trying to do.
All right, Mark Holland. Good to talk to you. Hope we get a chance to talk again soon. Take care, Minister.
Look forward to it. Thanks so much, Peter.